So this month marks 40 years since an illness was first reported in 5 different men, and that wound up being the beginning of the AIDS epidemic. And this morning we wanted to find out where things stand and how both our state and our country have made some strides. And joining me now, Dr. Colin Fields, Chief of the HIV and Preparatory Program at Kaiser Permanente, Washington. Good morning to you.
Good morning.
So, Dr. Fields, a lot of us have been focused on a different virus for the past year or so. So, if you can, what's the latest in our fight against HIV and AIDS?
So like you said, it's been 40 years since the CDC put out their morbidity and mortality weekly report that described 5 men in Los Angeles in their 20s and 30s who had a condition that we now know of as AIDS. And that became a condition that affected the world as another epidemic. Currently in the state of Washington, there are about 14,000 people who are living with HIV, but about 9% of those people don't know their status. So, HIV is a chronic medical condition at this point that is treatable. And so we encourage everyone to know their status so that we can help protect their health.
Doctor, we have been talking about the UN adopting a declaration on ending AIDS by the year 2030. Is that doable?
Well, I think that the increasing availability and effectiveness of antiretrovirals is helping to end the AIDS epidemic, but also pre-exposure prophylaxis, otherwise known as PrEP, has been one of the modalities that we have to actually reduce the transmission of HIV within our community. So what that is a medicine that can be taken prophylactically to reduce the risk of acquiring HIV if exposed. So I think that the combination of people knowing their status, people who are at risk taking PrEP, to reduce the risk of transmission of HIV, and then people living with HIV suppressing their virus within their blood are all modalities that we have to help reduce the risk of HIV and to hopefully someday end the epidemic itself.
Dr. Fields, you head up the HIV and PrEP program at Kaiser Permanente, Washington, and PrEP being the pre-exposure pill for anyone who might be at risk, as you mentioned. How much is your department focused on prevention?
Well, PrEP became approved in 2012, but it really took until about 2015 to start seeing uptake within people who are at risk. We are continuing to have more and more people on PrEP. We have our highest number of people on PrEP at this point in time. So we still are missing a number of people around King County and Washington State who would benefit from this medicine in order to reduce further infections across the state and nation and world.
And so what should folks do?
Well, you can be in contact if you're a Kaiser Permanente member with our PrEP program. We have a phone number, 206-326-3609, if you wanted to be in touch with us. But really what we want people to do, if you're between the ages of 15 and 64, we want you to get tested at least one time for HIV to know your status. If you think that you are at risk due to sexual exposures or intravenous drug use, we would like to have you contact us to be on a prophylactic medicine to reduce your risk of HIV transmission.
Dr. Colin Fields, thanks for your time. Appreciate it.
Thank you for having me.